Hi everybody, I am just waiting for my friend Naomi Potter, Dr. Potter, to join me, and we will be talking to you all about menopause. Nice to see so many of you here. Great, goodness, you're very used already, I think, to Insta Lives. This is mine and Naomi's first Insta Live with Fit&Well, so we're really rather excited, and we're going to try and keep things to about 30 minutes, and then I hope we'll give you a good overview of menopause, how we approach it, and of course what you can do to keep on top of things. So Naomi should be here any minute, and once she is, we'll get started. Here she comes now. I think she should be with us any moment. Yeah. Here she comes. There she is. Look at us. We've made it work.
Well done. And bang on 11 o'clock as well.
I know. For those of you that have never seen us before, usually Naomi is left sat there chattering away, desperately trying to hold it all together whilst I mess up joining the chat. So today I was in the driving seat.
Don't be too hard on yourself, Nigel.
Thank you. Thank you, Naomi. So I was just chatting to everybody saying we are really thrilled to be invited to come along for an Instagram Live with Fit&Well. We love the magazine, we love the feed, and this is a real treat for us. So because it's our first one, we are a bit of a double act. So we will introduce ourselves to you, but we want to keep this really quite sort of top level stuff today. Make sure that you really know what to look out for menopause, what menopause is all about, what sort of age it might happen, and what to look for the early signs that things are beginning to change. But most importantly, we really want to make sure that you've got all the tools and the confidence you need to go forward and manage menopause rather than leaving menopause managing you, because you really don't need to do that. So Dr. Naomi Potter is my very good friend, but more importantly than that, she is a brilliant menopause specialist doctor. She knows there is nothing she doesn't know about menopause, and most importantly, she really gets it. And so I think we'll let Naomi take the lead to start with, and just explain to you a little bit about menopause, what it is and what to look for.
Should I introduce you as well?
Nobody knows who I am. They just think I'm some bloke that fell in the room. Yes, please.
Just dropped off by the side of the road.
I was just delivering a parcel. Yeah.
So this is my lovely friend Nigel, who is our menopause dietitian extraordinaire, and he really knows everything there is to know about how to manage your diet in the perimenopause and menopause, and he has the most phenomenal but simple strategies that you can use to really get to grips with your weight and your diet and nutrition, and how to manage your midlife and beyond. Yeah.
Cracking. So tell us all about it, Naomi. What is menopause? When does it happen? And what should women look for?
So the perimenopause starts at any point. I mean, it can start at any point. Most commonly, it starts in the mid-40s, but it can be earlier. It can be in your 30s and even in your 20s, when your ovaries start producing less estrogen. And it's this lack of estrogen that gives you the symptoms that are so wide-ranging. They literally, from the top of your head to the tips of your toes, it can be hair loss, dry eyes, dry skin, chest pains, palpitations, tummy upset, periods changing, sexual problems, bones, muscle pains, brain issues, brain fog, concentration. I mean, the list is pretty endless.
It's a barrel of laughs, isn't it?
And so one of the things that we're talking about particularly today is the metabolic changes that occur. And you tend to find that you are more prone to putting weight on, especially around your middle. You are predisposed to laying down fat, and you lose muscle mass. And it's just, those are metabolic changes that arise because of the decrease in estrogen. I mean, but there is partly an aging effect, so it happens to men to a degree, but what tends to happen to women is it tends to be much more kind of falling off a cliff rather than a gentle slope. So really that's what happens.
And you mentioned perimenopause. So is it worth explaining, do you think, the difference between perimenopause and menopause?
So the menopause is after your periods have finished, and that's it. And it's a year after your last period, you are considered postmenopausal. But the period leading up to that is that whilst you're having these big hormonal fluctuations is known as the perimenopause, and you can easily still be having regular periods. Your periods you may have noticed them changing a little bit, but it's that time of it's hormonal turbulence and a general trend in a decrease in estrogen that gives you these symptoms. And they can come and go. So you might have 6 months of symptoms, 6 months without, 6 months, it's highly variable, but that is that time. And it's not really it's not a line in the sand. You don't suddenly become perimenopausal overnight. It's just this gradual change.
Yeah, and I think it's really important to stress that you can be having periods as regular as clockwork and be experiencing perimenopausal symptoms. So I think, for me, certainly, often a woman might present to me with the frustration of this upper body weight gain that she's experienced. And it usually is the upper body, because we tend to see that as the estrogen levels drop, you're much more prone to laying your fat down around your internal organs, a bit like a man would, essentially.
Yes.
Whereas previous to that, you would have laid down your fat under your skin, the subcutaneous fat. So it changes that. And that's where I think women often will say, and you might have heard girlfriends talk about this, where all of a sudden just blouses and bras don't fit the way they used to. And it feels like, well, nothing else has changed. What's going on here? Your whole shape is changing. And I mean, it can be quite dramatic. I mean, on average, when we look at studies, we could assume that a woman would gain around about 1.5 kilos for each year that she's in perimenopause. So that period that Naomi was talking about, when things are changing but your periods haven't stopped yet. Well, for some women that goes on for 6, maybe 7 years. It can do longer, maybe. And so that can easily mean that you might gain 10 kilos over that period, and that's a good dress size.
I find it so distressing because they're doing, they feel like they're doing the same thing. They cannot understand what's happening.
Absolutely. And I find often it's the women that have not really had to worry too much before that are most upset about this, because they come along and then, it's just all of a sudden the one thing they felt like they've been in control of now is out of control. And it really can feel like, no matter what you do, you're not going to change this. And the reality, I always have to say, is if you were somebody that could lose 3 or 4 pounds to go off on your summer holidays in your 30s, that type of plan is not going to work for you now. You now have a totally different body that is essentially deficient in the very hormone that makes you female. And we have to approach this in quite a different way to those usual sort of bikini type diets that you might have come across before. So it's very much lifestyle. And I think that's where we both join together so well here, because ultimately, working with Naomi to sort out your hormone imbalances is very much, it's a lifestyle approach. It's a lifelong approach, because your hormones are going to change. And I suppose it's kind of chicken and egg, really, isn't it? Whether somebody decides they want to see you first and sort out the hormonal issues, or they want to get the weight bit sorted out. And to be honest, it doesn't really matter.
Well, you can do it in tandem, can't you?
Well, of course, yeah.
Yeah. It tends to work both together.
If someone's approaching you, first of all, and with predominantly worried about other types of symptoms, what's the approach? What happens? How do you deal with that?
Dealing with people in their kind of menopause.
So yeah, if somebody's decided, oh, I know my weight isn't too much of an issue, but I am, my mood is all over the place. I can't concentrate. I've got this brain fog, and my sex drive has disappeared. How do you tackle that? Do you send them for blood tests? What do you do to see?
So it depends. So I see them, and we have a long chat about all of their symptoms, all of their medical history, family history, anything else that's going on, and then I ask them what they want to do. So I offer hormone therapy if that's what they would like, and we would run through all of the risks and the benefits, predominantly the benefits, because that's where hormones are brilliant. And we make a decision together. So if you are over the age of 45 and you have classic menopausal symptoms, you do not need blood tests to diagnose the perimenopause. So you can start hormones without blood tests. I mean, blood tests are very unreliable in women over the age of 45 to diagnose menopause.
Is it fair to say that's a bit of a clue? If your GP just wants to run hormone tests to see what your hormone levels are like, it's a bit of a clue that you might want to see a GP who really gets menopause.
Yeah, so if you're 48, 49, you go to your GP, you say, I think I've got perimenopausal symptoms, I'm still having periods, and they say, well, let's do some blood tests. Your GP isn't really sure, it doesn't really know what they're doing with regards to this, because that's not what the guidelines say, and it's not what the evidence is. You can have normal blood results and still require estrogen, or estrogen will still help you.
Well, it makes sense. If your hormones are like a roller coaster, and we take a blood test now when you're at the top of a big hill, that's what it's going to show us right now. But half an hour later, they could be down here, and you can't remember your own name.
And don't get me wrong, blood tests are helpful in some cases. So they're helpful in women under the age of 45. They're also helpful when you want to exclude other things. So it's really nice to have a woman at this point in her life, and when she may not have had any screening tests for anything, and do things like cholesterol, glucose, B12, folate, iron, all of those things, just to make a vitamin D, just to make sure, thyroid, the list keeps coming, but not to preclude her from having hormone therapy.
Sure.
And they're also useful for monitoring treatment. So if a woman's absorbing estrogen properly, does she need testosterone, those kind of things, then absolutely. So I'm not saying blood tests are wrong, but they shouldn't be used to diagnose the menopause in women over the age of 45, and they certainly shouldn't prevent you from receiving your treatment.
So really the key for diagnosis is the woman herself. Absolutely. Knowing what's changing, some things that are just not how they were a few years ago. And remember, as Naomi says, this isn't just about gynae type changes. So, you hear about things like vaginal dryness, and that can be part of menopause. But you have estrogen receptors in almost every cell of your body. And so the symptoms can affect everything.
Absolutely.
And rarely do they affect everything in every woman, but they're so varied. Don't ever think that something that you're noticing that is a change is irrelevant. Mention it, because the likelihood is it will be connected.
Absolutely. I
Yeah.
can't remember the last time that I had a patient who came to me with hot flushes, night sweats, and periods getting less frequent as her main symptoms. I literally can't, and those are your kind of classic
Yeah.
menopause symptoms, but I literally cannot remember the last time that that was somebody's only prime symptoms. So everybody's
Yeah.
different, and it's about finding a doctor who, it's the menopause radar. It's about
Yeah.
finding a doctor that knows what to ask for, what to look for. Because a lot of women just sit and say, but I don't think this is related, and I'm not sure that's related, and I thought I was going mad, and I thought I was, and actually, of course, it's all related, it's all important.
Yeah. The lady's just mentioned something there. I missed your name, but she was saying about, you know, her mum was early and she was early. And that's something that quite often happens if you look around, doesn't it? At mothers, grandmothers, siblings, and you might well follow the patterns they do.
Absolutely. We also missed another question from a lady who said she's been on patches for a couple of years. Can she stay on them? And that's a good question because it comes up a lot. You can stay on HRT for as long as you find that the benefits outweigh the risks, and it's always so. If you have an early menopause, it's very important to stay on the hormones until 50-51 because there's no increased risk of breast cancer, but there is also a huge protective effect on your heart, your bones, your brain, and it's very important to replace those hormones. After the kind of average age of menopause, then it's the reason why we have follow-up consultation, so an annual review with a doctor that knows what they're talking about to decide whether or not to stay on HRT. And if you are finding that your symptoms are well controlled, you're low risk, and you want to stay on it, then there is absolutely no reason why you can't stay on it.
Oh gosh, we've got ladies that come to my clinic in London in their 90s still on HRT, and if, my goodness, if you try to take them off, they'd break your legs. You know, so yeah, and this is, I think, the beauty of working, certainly, I think, from my point of view, working with somebody like Naomi, because we both have such a similar outlook. You know, we're not the sort of health professionals or practitioners that tell you what to do. We work with you. We're a team, and you have to, you know, you're the one who's in control of this. Our role here is to tell you what your options are, put your mind at rest about the things that you don't need to worry about, raise your awareness of things that perhaps you do need to give some attention to. Like, for instance, there's so much emphasis around things like female types of cancers at menopause. The one thing that nobody ever thinks to tell you is that once your estrogen levels reduce to the levels that they are in menopause, which is essentially about the same levels as a man's, really, your risk of heart disease jumps up to the same level as a man's. Nobody tells any women about that. And the awful thing is, more women die of heart disease than anything else in the UK. So that's kind of where I come in. I think often people think I'm going to be offering you an alternative to HRT to manage your menopause, and that isn't what I do at all. Diet really cannot touch the sides on so many issues and symptoms. What I can do is get the weight gain sorted out, make sure your bone health is in the best position it can be, and that you're protected as well as you can from by lifestyle from heart disease. So if we think about the weight, the first thing we have got to do is, again, not hand you a menopause diet sheet. First thing we've got to see is, well, what are you doing right now? Because I need to create with you a lifestyle plan that is going to suit you for the rest of your life. And that's going to mean we need a simple 500 calorie a day deficit. And the way we might do that is by looking at your snacks, looking at your grazing, the sort of foods that you eat standing up in the kitchen or in the car or when you're traveling to work. what your booze intake is like, what your portion sizes are like, where we can make small changes that are manageable. At the same time, I'm also looking to see, well, what's your oily fish intake like? What's your soluble fiber from things like fruits and vegetables and oats? What is your salt intake like? Because I want to look after your heart. At the same time, what's going on with your calcium intake? So we can do all of it together, but it absolutely has to be a personally tailored approach. At the same time, I don't need you necessarily to leap into the gym and start enrolling on classes left, right, and centre. But what I do need you to do is get your physical activity levels increased. And sometimes just by increasing your walking, your step count up to that magical 10,000 a day, that can be enough to lose a stone over a year without even changing your diet. So this is Janet and John stuff. But it's lifestyle and lifelong. Whatever you're going to do now to control this weight is what you will have to do forever. You know, nature's a crazy thing when you think about it. You will probably spend more of your life outside of the fertile years without estrogen than you will with it. But nature never intended that to happen.
But just like, so how, what we were saying before about that, so this weight gain that people have experienced in lockdown just shows you. So a lot of people have put on half a stone or a stone just in what, 3-4 months by those subtle differences in lifestyle. So the subtle differences in eating and the subtle differences in exercise. In the same way, you can reverse it by making those subtle differences in reverse, by just increasing your exercise or your movement by a proportion, and by just cutting out on that snacking or that grazing or or by decreasing the portion sizes. So it is possible. It's not.
Oh, totally possible. And I think what's, you know, again, the good news part of this is that the reason I think probably Naomi and I really love working in this area is that for an awful lot of women, this is a point in your life where you've maybe got the headspace to sit and look at your life and decide what you want for the next few decades. Maybe you're at a point where you don't need to strive to get to the top of your career. You're there. You know, you're already doing really well. Your kids are kind of looking after themselves. Sometimes, you know, not always, but sometimes you're kind of a bit more financially secure. Life is just less of a worry. That, you know, it is a natural time to sit and reflect on how life has been and how you want it to be. And I mean, I'm so certain that the menopause years can be the best years of your life. You know, look at the confidence you can have now, not worrying what people think about you. But unless you take charge of it, it can eat away at your confidence and it can really start to intrude on the day. And I think, again, if you only take one message away from this short chat today, it is, you know, take charge of it. There is a wealth of help. There's a wealth of treatments. I mean, my goodness, the sorts of hormone treatments that are available. There's 50 odd different types.
Yeah, if you can get hold of them.
If you can get hold of them at the minute. That's another session. But essentially, you know, your hormone treatment, if you decide to take that route, can be tailored to you. So just as I don't use a standard diet, Naomi isn't going to use a standard HRT, that we work out what's going to be best for you. And actually,
so I was just going to ask you, what I get asked a lot is if you just had like 3 top tips. I know I've got one, but if you have 3 top tips, what would your top tips be?
Mine would always be start with a food and activity diary for at least 3 days so you can see exactly what you're doing. It will be quite enlightening, I'm sure.
Do you write down everything?
Everything. Food, drink, everything that you eat, where you eat it, who you're with, how you feel when you eat it. Let's see what happens when you're stressed and angry and emotional. Let's see what happens when you're with your mate who tries to encourage you to have a bit of cake or whatever it might be. Let's have a look at the whole picture, and that's immediately going to show us what needs to be done.
Right.
It's so useful. And count your steps, and whatever they are right now, increase them by 5,000, and
Okay.
pick 15 minutes worth of weight resistance exercise to do in the morning. That could be simple Pilates moves, it could be using some hand weights, but if you concentrate on upper body work, that will really help generate this new muscle tissue. And that's the bit that reverses time. That's the bit that speeds that metabolic rate back up to the
Right.
point where it was before.
Right.
What about you then? So if somebody's sitting there and thinking, my doctor wants to do blood tests and he doesn't get this at all, how would they even find somebody like you?
Sorry, what do you mean?
If they
You,
decided,
as
all
in,
right, I want to see a
if they're,
specialist,
oh, I see.
because they've
Well,
got every right to ask for
they do,
referrals, haven't they?
oh, they do. You can start to see me. You just self-refer. It's
Yeah.
easy to go online and yeah, I don't need a GP. I don't need a GP
And
referral.
if they don't like the look of you and think they want to see another menopause doctor,
Just
can't.
Google menopause doctor.
But I think there's the British Menopause Society. You can even
You can
put
find,
in
yeah,
your
you can find
postcode and
specialists. Yeah,
find the nearest ones to you, and just
absolutely.
ask for a referral. It's
Yeah.
your right.
Yes. Yes.
So I think that's our point. Is yeah, we see people remotely using Zoom and what have you, but you can probably find somebody locally as well. It's very easy, and I think life is changing. It is getting better for women. We're talking about this a lot more. I
Yeah.
think do you know something I heard the other day as well? If you've got daughters, tell them about menopause.
That's
Just
what
like
it's
you've
not happening.
prepared
Is it?
them.
I hear that so often that that we I ask patients how old their mother was, or what kind of experience they had, and they often don't have any idea at all.
No.
They witness, so they reflect back and they say, oh, I thought she was stressed or depressed or those kind of symptoms, but
Yeah.
it was never labeled. But maybe they didn't realize either. Maybe their mothers didn't link the two.
No. But the chances are, you could easily have teenage daughters that are going through the other end of
Yeah.
things and all the hormones there. You've got it now. Tell her that, to be ready for this, but not to be scared of it, because there's plenty of support and help out there.
Yeah.
We're hoping that we might be invited to come back at some point and talk a little, in more detail about things like HRT and about bone health. And really, I think the sorts of things that you will just ask us what you would like to know about menopause, hormones, diet, weight, HRT, all of the things that we deal with. But this, I think, this lockdown period there's some benefits from this. Most of us have had a little bit of time that we didn't have before to look at our lives and just make some notes about how we're choosing to do things. And I guess whatever time of lockdown we've got left, if you think things are beginning to change, it might even just be worth keeping a menopause symptom diary for a few
Absolutely.
days.
That's really helpful. When patients come in and they've written things down, it's really helpful, because often when they get to see you, they're anxious. They're anxious that they're going to they're going to be listened to, and they're anxious that they're going to get what they want and what they need, having previously been fobbed off at so many times. And so when you're feeling anxious, it's often harder to actually say how you're feeling. So even if if you're just going to your GP, it's really helpful. Even if you think that the symptoms are not related, they are most likely to be. Please write them down in advance, and you can even just go in and show, hand a piece of paper over if you don't feel that you're going to be able to verbalize it at the time. But that's really helpful, and it should help you to get what you need.
Somebody's just asked if we can let them know our websites. So mine is Nigel Denby dietitian.co.uk. What was yours, Naomi?
I'm drnaomipotter.com, dr as in drnaomipotter.com. It's only recently that I learned how you spell dietitian, Nigel, when I was trying to put your website details in.
In England, dietitian has a tit in the middle.
It does.
Yes, T-I-T. But the Americans do it with a C. That's why, yeah, it always comes up that way. But of course, we have to try and be different, don't we? Lovely. Somebody's enjoyed it. Lucy wants us to do some more, which is great. We've probably got, if anybody's got a burning question, we've got about a minute left before we have to go. But it looks like, I can't even see how many people have been here, but it looks like there's been lots of you joining us, which is so nice. And I think if you want us to cover anything in the future, we've both got Instagram accounts. So Naomi is Dr. Menopause Care. I'm what am I? Menopause _ dietitian.
With a tit in the middle.
Yes, with a tit in the middle. Send us a message, a direct message, and then we'll talk to our mates at Fit&Well and ask if we can do something. Thank you. Somebody says that's really nice. They're going to play us back and watch for some more again, which is great to hear.
And it'll go on the Fit&Well Instagram feed, won't it?
It will, yeah. And I would have thought we'll try and get it on our own feeds as well. Thank you, Susie. That's lovely. Yes. If the IT works, we'll get that bit working. But have a brilliant day, everybody. And thank you so much for making us feel so welcome. We'll certainly be back. So, yeah, thank you very much.
Okay, brilliant. Thank you.
See you.
Bye.